More women are said to be gaining weight. UCT doctoral student Moete Ngazli found that there's been a high increase in overweight and obese women. Her research found that obesity is more prevalent in women from wealthier socioeconomic backgrounds. To speak more about this, she joins me now live. Thank you so much for your time. We do appreciate it. Perhaps just tell us a little bit more about your research and what you have found.
Thank you for having me. Good evening, viewers. My name is Moete Nglazi, and my research looked at the prevalence of overweight and obesity among women of childbearing age. And these women were from 15 years to 49 years. And it looked at a period using national surveys from 1998 to 2017. So the study found that overweight and obesity prevalence was increasing over that period of time. And it also identified several factors that contribute to the overweight and obesity prevalence increasing. Like you mentioned earlier, wealthy women compared to their poorer counterparts were more overweight and obese, as well as women who resided in urban areas, and as well as women with a higher educational attainment and those with increasing age. And this study is important because women of childbearing age, they are at risk of having children that are overweight and obese. And this has implications because people develop, if you're overweight and obese, you have a higher chances of developing non-communicable diseases, things such as diabetes and some cancers. And also this impacts on the economy, as well as also the social protection services of the country. So it's important that we find interventions for these women.
Well,
so
sorry
that,
to interject there. Sorry to interject there, but perhaps what are some of these interventions? Because I think if I'm not mistaken, some of the contributing factors include a lack of physical activity and an increased consumption of unhealthy foods. And many would say people just don't have time to work out, or people just don't have time to cook healthy food, and they grab something on the way home. And this obviously contributes negatively and increases obesity. But you know, how can they sort this out? What is the solution here?
Yeah, that is correct. Already the government has put some interventions, such as the tax on sugar sweetened beverages. But there's need to do more. So perhaps interventions that are targeting the factors that are identified in the paper could help to actually target these women of childbearing age, as well as reducing their chances of transmitting overweight and obesity to their children, and compounding the effect that it has on the economy and also on the social protection services.
Just lastly, is the situation dire? Is the situation concerning, or is it manageable, do you think?
I think it is concerning because it has a lot of effects. Like, for example, the overweight prevalence increased from around 51 to 60%, and then obesity increased from about 25 to 35%, which is, and South Africa has a higher prevalence compared to other countries in Africa. So I think it is alarming, and something needs to be done because it can have wider impacts. And so there's need to raise awareness, and also people need to need to change their behavior. And also one concerning factor is because of the COVID-19 pandemic, where living with obesity is one of the risk factors for COVID. So there needs to be, these women need to be vaccinated and tested so that they don't have adverse outcomes of COVID-19 as well.
Okay, great. Thank you so much for your time. We do appreciate it. I'm sure that this will yield some kind of results, and hopefully people understand the seriousness of the situation. Thank you so much. That was doctoral student at UCT Moeti. Now we'll be back.